This is Radio Health Journal. I'm Nancy Benson. This week, tonsil stones, a little problem that causes a big stink.
I just operated on a 46-year-old for tonsil stones, so they can come at any time.
We'll find out why such a little problem is such a big thing when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Farmers consume somewhere in the neighborhood of 80% of all the water in the West.
Water levels are at record lows. How can we consume less and increase supply? Then,
in the 1960s, 95% of what Americans wore was American-made, and today that is less than 2%.
The true cost of cheap clothes. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Most people don't think about their tonsils until they have a problem with them, and that doesn't happen as often as it used to. In recent decades, the number of tonsillectomies performed in the United States has declined. More people are keeping their tonsils through adulthood, and that's a good thing. According to Dr. Alter Peerless, an otolaryngologist at Mercy Health in Cincinnati, tonsils are an important part of the immune system.
The tonsils are lymphoid tissue, the same tissue that is found in lymph nodes that we all have in our neck and our groin and under our arms. And the job of lymphoid tissue is to filter out infection. In the throat, the tonsils are in the back of the throat. What we normally think of tonsils are what are called the pharyngeal tonsils. There is, in addition, tonsil tissue on the back of the tongue and tonsil tissue behind the nose, and those are called adenoids.
When the tonsils work to keep infection out, they can sometimes become infected themselves. Before the widespread use of antibiotics, tonsil removal was often the answer to stop recurrent strep infections there. But while more people have their tonsils these days, that means they're more susceptible to developing what are called tonsil stones, hard, light-colored lumps that look just like they sound, as if a person has pebbles growing in the nooks and crannies of the tonsils.
Tonsil stones occur because the tonsils, like everything else in the body, is lined with skin. Because tonsils are lymph tissue and are supposed to filter out bacteria and virus that we breathe in, they have grooves in them that we call tonsil crypts. The tonsil crypts are lined with skin just like every place else in the body, and like every place else in the body that is lined with skin, the skin sheds. Every time we shower or wash our hands, we shed skin. And shed skin in some of these tonsil crypts will form tonsil stones.
But it isn't just dead skin that can get caught in tonsil crevices to create stones.
Tonsil stones are from food and cells and bacteria that collect in the pits on the tonsil surface. Over time, that debris hardens and forms into a stone.
That's Dr. Lauren Boehm, assistant professor of otolaryngology at the University of Michigan. She says tonsil stones are rarely harmful, but they are unpleasant. They're often smelly, and it's disconcerting to have visible white or yellow flecks in the back of the throat. Tonsil stones can range in size from smaller than a grain of rice to the size of a large grape. Peerless says the stones form to fit the shape and grooves of a person's tonsils, so some people are simply prone to develop tonsil stones through no fault of their own.
There's really nothing that predisposes to it except the anatomy of the tonsils. Patients have tonsil stones because their tonsils happen to have crypts in them, happen to have particularly deep crypts.
However, that means tonsil stones are unpredictable. There's really no one group that gets them more than others.
I would say that I see them in my practice every week. They're quite common. Honestly, I see them in all ages. I just operated on a 46-year-old for tonsil stones, so they can come at any time.
Most of the time, tonsil stones are just an annoyance, not a major medical concern. They don't keep the tonsils from performing their function in the immune system. But Boehm says they do have some very unpleasant symptoms.
One of the most common symptoms is bad breath. People can also develop a sore throat with some discomfort in the area of the stone. Alternatively, some people actually feel pain in their ear as opposed to their throat because of shared nerve pathways. If you look in the mirror, you may notice white or yellow debris on the surface of the tonsils. The tonsils themselves may become swollen or cause difficulties swallowing.
With those symptoms, it's no wonder people are unnerved by them and are motivated to perform some behaviors that can help prevent them.
We know that good dental hygiene with regular brushing and flossing can help prevent tonsil stones.
Good oral hygiene, and by that I mean gargling frequently with either mouthwash or salt water, would probably be helpful.
However, sometimes there's not much a patient can do to stop tonsil stone development. Fortunately, they can be removed.
Sometimes tonsil stones become dislodged on their own. Other times, particularly if they're causing discomfort, they can be removed. Typically, we would recommend having it done at a doctor's office. Usually that can be performed using some local numbing medicine. If it were to be performed at home, we recommend not using anything sharp to avoid any injury to the throat area.
Peerless says some people dislodge tonsil stones themselves using a Q-tip, but that's not recommended. If they recur over and over again, he says an otolaryngologist can perform a procedure to keep them from coming back.
If the tonsil stone is coming from one particular crypt, just one area of the tonsil, I will sometimes try as an office procedure to cauterize, to use either an electrical or a chemical cautery agent to close that crypt down and make it smaller and less prone to collect the tissue that forms stones.
Boehm says some patients have tonsil stones that are so troublesome and recurring that virtually nothing works. That's when Boehm will suggest making recurrence impossible with a tonsillectomy.
It's usually an individualized decision that is made between you and your physician. We oftentimes will weigh factors like degree of symptoms, reduced quality of life, and time away from school or work.
Tonsil stones produce medical problems and pain only occasionally, but carry an enormous ick factor with their smelly breath and disturbing visual. So tonsil stones often produce more of a response than their size and medical significance might suggest. You can find out more about all our guests on our website, radiohealthjournal.org. Our writer-producer this week is Morgan Kelly. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
COVID-19 vaccines are rolling out, and many Americans are looking forward to getting back to normal. However, chronic stress of the past year can impact memory, mood, and anxiety. So during June, Alzheimer's and Brain Awareness Month, the Alzheimer's Association reminds you to make brain health a priority. Beth Kallmeyer, Vice President of Care and Support for the Alzheimer's Association, has tips to restore mental well-being.
First, think about recommitting to brain-healthy basics, like regular exercise, a heart-healthy diet, and getting plenty of sleep. Try to unplug from technology every night. Do what you can to manage your own stress, especially if you're a caregiver for a person living with Alzheimer's or dementia. And return to normal at your own pace by taking small steps and setting boundaries.
Kallmeyer says it also helps the brain to help others by volunteering in your community. For example, by supporting the Alzheimer's Association's The Longest Day event, June 20th. Find out more about Alzheimer's and Brain Awareness Month at alz.org.
Pandemic school closures have taken a large toll on both children and their parents, socially, emotionally, and academically. But with prevention steps, including regular PCR-based COVID-19 testing, outbreaks in schools may be largely prevented. In fact, the Biden administration has identified testing in schools as a critical proactive step in recovery from the pandemic. Here's Shiraz Latiwala, Senior Vice President of Business Transformation Projects, Thermo Fisher Scientific.
Testing for schools can be done accurately, efficiently, and affordably by using pooled PCR testing programs where multiple samples are tested at once. Batch results are reported as positive or negative and returned in 12 to 48 hours, helping to quickly indicate a potential outbreak.
Highly accurate COVID-19 testing helps school administrators detect outbreaks quickly, so informed decisions about in-person learning can be made. Find out more at thermofisher.com/COVID testing for schools.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA revoked the approval of fenofibrates when added to statins, as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrates, such as Tricor and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
When it comes to health, there is one area that can be difficult to talk about: colon health. Yet this critical area of well-being is heavily influenced by lifestyle choices. Research shows that 75% of colon cancer cases can be avoided by individual actions, and diet is one critical factor. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
To promote colon health, a diet rich in whole plant-based foods and low in red meat, especially processed meat, is recommended. An easy first step is to eat more vegetables and fruit, including grapes. Fresh grapes have over 1,600 beneficial plant compounds, including antioxidants and other polyphenols. Research indicates that consuming grapes every day may help support a healthy colon.
Maintaining a healthy diet and weight, not smoking, exercising regularly, and getting screened are other important colon health steps. Grapes of all colors, red, green, and black, are part of a healthy diet. Visit grapesfromcalifornia.com for more information.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Not going to get your child to be 5 feet 10, 6 feet if they were destined to be 5 feet 5 inches.
Growth hormone for short kids. It's not everything some parents think.
Then, a rare genetic disease whose most deadly symptoms are often hidden.
And that's really the scariest and most critical issue that people with Marfan's will have.
All that and more on Radio Health Journal.